Hi everyone, it's Abdul Mannan here. I'm a GP in Haslingden. Just doing a video really. I was doing it for the benefit of our patients at the surgery, but I thought it would be useful for everybody really in Rosendale and beyond. The recent directions around vaccine groups might be a bit confusing, so I thought a video might be helpful rather than trying to type out an essay, basically. Now, as things stand, the vaccine centre in Rawtenstall, that's the primary care network PCN vaccine site in Rawtenstall, it is open and we are still vaccinating people. But as I said before, we have to follow directions from higher up in terms of which group we do and when we do them. Thus far, we have done groups 1, 2, 3 and 4. So anyone above the age of 70, we have vaccinated. There may be one or two because they've been ill or they've been in hospital or whatever, one reason or another, and these people are being vaccinated as we speak. Now, the plan was to move on to Group 5. Now, Group 5 are the people who are between ages of 65 to 69. Now, the announcement from higher up from NHS England is that this group will now be sent invitations to go and have their vaccines done at the mass vaccination sites or tertiary sites such as the pharmacy sites. So, for example, locally we have a mass vaccination site in Blackburn and we have one in Burnley opening up soon, and we also have cops running around. I don't know why. Not me. So Burnley site will be open soon, and also we have pharmacy sites as well. So you can wait for the letter to come to you, or you can go online. I have shared the link on my surgery Facebook page. I can share that on Healthy Rosendale later on, I suppose. So you can book that online and go and have your vaccination done at those sites if you are between the ages of 65 and 69. Now, for whatever reason, if you want to have that vaccine done locally in Rawtenstall because you can't travel for some reason, or you're too ill to travel, or it's inconvenient for you, then you must let your GP surgery know. Your GP surgery will keep you on a list and they will contact you when there are vaccines available and when they can book you in. So that's Group 5. Now, what we've been told by NHS England is to focus on Group 6. And so we will be calling patients who fall into Group 6 in the following categories. Now, you can go online and read up about this, but I'll try and explain to the best of my ability as to who are in Group 6. Group 6 essentially are people who are between the ages of 16 and 65. Now, that's not everybody in that group. There are certain conditions which qualify you to be in that group. And that is a number of conditions. Number one, if you have a chronic respiratory disease. So what does that mean? That means, and I'm going off the list I've got in front of me, so I might not be looking at the video, so I do apologise if I seem a bit rude. So chronic respiratory disease includes people who have severe lung conditions. For example, asthma, COPD. In terms of asthma, it's not everybody with asthma, it's people who are requiring repeated use of oral steroid tablets, so like prednisolone, for example. And if you've been taking, let's say, a course every month for the last 3 months or consecutive months in the last year or so, so you would be assessed as somebody who has considerable lung condition because of asthma. So it's not for every asthma patient. As regards to COPD, if you suffer from COPD, you'd qualify, including if you have chronic bronchitis, emphysema, bronchiectasis, cystic fibrosis, other types of lung fibrosis, if you have pneumoconiosis, pulmonary dysplasia, those kind of lung conditions. Something I missed earlier on is if you required hospital admissions because of an exacerbation of asthma, that would also qualify you in that category. The next group of people are people who have chronic heart disease and vascular disease. So congenital heart disease, people who are born with heart problems, hypertension, high blood pressure with cardiac complications, right? Not just with high blood pressure, people who have high blood pressure with heart conditions would qualify. Chronic heart failure, so if you have long-term heart failure, people who require regular medications and follow-up for ischemic heart disease, so like angina conditions which require regular medication and review from the GP or your consultant. People who have atrial fibrillation, so that's irregular heartbeats. People who have peripheral vascular disease, so vascular problems peripherally in your feet or your hands or whatever, but mainly we find in the legs and feet. Other than that, people who've had venous thromboembolism, so if you've had a DVT, if you've had a PE, so that by that I mean clots in the legs or clots anywhere else in your body, including your lungs, you'd qualify under that category. People who've had chronic kidney disease, so anybody who fall into stages 3, 4 and 5 of chronic kidney disease would qualify. Anybody who have chronic kidney failure, anybody who has nephrotic syndrome, and anyone who's had a kidney transplant, you'd fall into that group. Chronic liver disease, so liver problems such as cirrhosis, biliary atresia, chronic hepatitis, you'd fall into that category. Neurological conditions, chronic neurological disease such as strokes, people who've had TIAs, transient ischemic attacks, so mini strokes, people who have had conditions in which respiratory function is compromised because of the neurological disease. So, for example, polio sufferers. And that includes people like people who have CP, cerebral palsy, severe or profound learning disabilities, Down syndrome, MS, multiple sclerosis, epilepsy, dementia, Parkinson's disease, MND, motor neuron disease, and similar conditions. If you've got hereditary and degenerative disease of the nervous system or muscles, or severe neurological disability, you'd also qualify. Diabetes. Anybody with diabetes, including people who control it with diet, you'd qualify. The next category is people who are immunocompromised. They have immunosuppression. Now that could be due to treatment, like people who are undergoing chemotherapy, or people who are taking medication that suppresses the immune system, like radical radiotherapy. They've had organ transplants, so they're on medication to suppress their immune system. They've had bone marrow or stem cell transplant, HIV infections, any stages. Multiple myeloma, genetic disorders affecting the immune system such as IRAK4, NEMO, complement disorders, SCID, SCID. Individuals who are receiving immunosuppression therapy or immunomodulating biological therapy are included in this group, such as anti-TNF, alemtuzumab, ofatumab, rituximab, and if you're receiving protein kinase inhibitors, PARP inhibitors, steroid-sparing agents such as cyclophosphamide, mycophenolate, mofetil. So if you're being treated or likely to be treated with systemic steroids for more than a month at a dose equivalent of prednisolone at 20 milligrams or more per day for adults, then you'd fall into that category as well. Anyone with a history of hematological malignancy, leukemia, lymphoma, myeloma, SLE, systemic lupus erythematosus, rheumatoid arthritis, psoriasis, that need long-term immunosuppressive treatments, you'd fall into that category. Most of the most severe immunocompromised individuals, like CEV, individuals who are not yet on CEV list but who are about to receive highly immunosuppressive interventions, so like the clinically extremely vulnerable, you'd fall into that category. Immunosuppression might be about to be increased and it's part of the plan with the consultant. You'd fall into that category as well. So I think that kind of sums up most of that group. If you don't have a spleen, for example, or if you have a problem with spleen, for example, homozygous sickle cell disease, thalassemia major, celiac syndrome, then you'd fall into that category. If you are morbidly obese, so if your body mass index is above 40 kilograms per meter squared, then you'd fall into that category. Next category is severe mental illness, so people with schizophrenia, bipolar disorder, and any mental illness that causes severe functional impairment, you'd fall into that category. Now, very important, next category, adult carers. Those that are eligible for carers allowance, or those who are the sole or primary of an elderly or disabled person who is at risk of COVID-19 mortality, and therefore they're clinically vulnerable, you as a carer, you'd qualify. Now, younger adults in long-stay nursing and residential care settings, these people who are in those kind of homes are, increased risk of exposure, and therefore they are eligible. Now, the few other things to note, in terms of younger adults, the vaccine, between the ages of 16 and 18, we'd be giving you the Pfizer vaccine because the AstraZeneca isn't licensed for people under the 18, so you don't really have a choice there at all. In terms of adult carers, let me just clarify that again because it came up a few times in my question and answer session, and I'm sure people will be asking. So if you're in receipt of carers allowance, paraphrase, those who are main carer of an elderly or disabled person, someone who has severe mental illness, or those whose welfare may be at risk, if the carer falls ill, you'd qualify under this category. All right, so that covers a lot of people. Now, anything else? I'm just looking at my notes. Clinically extremely vulnerable. Now, we've covered a lot of people in that category before, but just to remind a few things about this group, the majority of children, including CEV, should not be vaccinated at the time on the basis of low morbidity. So this is about children under the age of 16. We're not doing that category at the moment because the risks are low, and also tests are ongoing as to how suitable vaccines are in that age group. So bear with us in terms of the under 16s. As I said before, ages 16 to 18, Pfizer vaccine only. The 12 to 16 age group, that's something that's been looked at the moment. More information will flow eventually, but bear with us. Generally speaking, under 16, bear with us. I hope what I've just said isn't too confusing. You can go online and read about this. You will be called by your practice in due course if you fall into these groups. So essentially what I've said is group 5, the mass vaccination centres will be contacting you, or you can go online and book at any site locally. If you prefer to come locally, then you need to let your practice know so they can put you on a list. And as a priority, we'll be looking at group 6, people who are vulnerable, and I've just gone through those groups. You can access that information online, and bear with us, we'll be going through the groups slowly but surely. Thank you very much. Bye.